Curado. How are you today?
Good, and you?
Good. I'm gonna be your nurse for today. I'm gonna be assessing you from head to toe just to make sure everything's alright. I'm gonna start closing the curtain to ensure privacy. I'm gonna wash my hands to maintain hygiene. I'm gonna make sure the environment is safe for you. And let me write down. Do you have any allergies?
No.
Do you have any pain?
No.
No?
No.
Okay, perfect. Do you know where you at?
Yeah, in the hospital?
Okay. Do you know the President of the United States?
Joe Biden?
Okay. What the date for today?
Today is Wednesday.
Okay, perfect. What is your age?
28.
28. So the patient is oriented and is as her stated age. Okay, one more thing. Let me check. Okay. I'm gonna be taking your vitals. I'm gonna start with the blood pressure. You may feel a little bit of tightness, but it's pretty normal, okay? Give me a second. Okay. You have 108/80, which is normal. I'm gonna take your heart rate. Okay, just give me a second. Perfect. You have 65 beats per minute, which is also normal. And I'm gonna be assessing your respiration. Just breathe normally. Okay. Just give me time. have 16 respiration per minute, which is also normal. So last thing, the patient look that maintains a good hygiene. There's no odors. And now I'm gonna be assessing your skin, your nails, and your hair. Okay?
Okay.
So have you had any changes in your skin, in the color of your skin?
No.
Any changes in the texture?
No.
No? Okay. Now I'm gonna be assessing the skin. Can you show me your arms? Okay, your feet, okay. So normal color. There is no abnormal findings in the texture. The temperature is normal. You can put it down. Okay, just give me a second. Oh, okay. What else am I missing? Okay, I'm gonna check for your hair distribution, and it's evenly. That's good. There's no sign of pediculosis. That's also good. And then can you do this for me? Okay, perfect. There's no clogging. Okay, now I'm gonna check your eyes, your nose, and your ears and mouth and throat. Okay.
Okay.
So have you had any changes in your vision or your hearing?
No.
No, anything?
No.
No. Okay, perfect. I'm gonna check first for your ears. Okay. Okay. There's no drainage in your ears. There is symmetry in your ears. Okay. When was your last time that you went to check up your eyes?
Oh, last month.
Last month.
Yeah.
Okay.
Mhm.
That's cool. So you use glasses, right?
Yes.
Okay. Can you take it away, please? Okay. First, we're gonna do follow my finger, please. Okay. Without moving your head. Okay, perfect. No abnormal findings. Now I'm gonna check for your pupils. Okay.
Okay.
Perfect. So pupils accumulate to light. That's good. Now, have you had any changes in your respiratory system or your sinus?
No.
No? Okay. Cool. Now, I'm gonna check your nose. Okay. There's no drainage in your nose. And now, can you open your mouth for me? Okay. There's no lesions in your tongue. Can you say ah?
Ah.
Okay. So there's no inflammation in your tonsils. There's no inflammation in your tonsils. That's all right. What else we're missing? Okay. I'm gonna continue with the neck. Okay.
Okay.
So let's gonna move your head down and then up and then side and then to the other side. Okay, right. Good range of motion. Now, can you open your mouth again and say ah ah? Okay, and then close your mouth again. Okay, open again the mouth. Okay, close it. Okay, I was assessing the temporomandibular, and that's good. We're gonna assess for the trachea. And can you swallow? Okay, that's good. Now I'm gonna palpate your lymph nodes. I'm gonna start with the preangular and then the posterior auricular. I'm sorry, it was a preauricular, posterior auricular, the parotid, the tonsil, and then the occipital, and then the submandibular, the submental, and the cervical. Okay, there's no tenderness and no swelling, so that's good. We're gonna continue with some questions about your lungs. Have you had any difficulty breathing or any frequent colds?
No.
No? Okay, I'm gonna start. Can you stand up a little bit? I'm just gonna compare your front with your back. Okay, front, back, and then your lateral side. Okay, so it's good. I just wanna make sure there's no barrel chest. Okay, you can take a seat. And now I'm gonna auscultate, which means I'm gonna hear the sounds of your lungs, okay? I'm gonna put this inside. I'm gonna start with your right upper lobe, and then your left upper lobe, and then your left lower lobe, and then your right lower lobe. Okay, there's no abnormal sounds. I'm gonna hear from the back, starting with the left upper lobe, and then just give me a hand, and then your right upper lobe, and your right lower lobe, and last your left lower lobe, and the lateral side. Okay, perfect. Now, have you had any palpitations, any chest pain?
No.
No? Okay. I'm gonna assess your chest expansion, which looks normal. Now I'm gonna palpate, if you don't mind me, I'm just gonna palpate your apical pulse. +2. I'm gonna palpate your carotid pulse. +2, which is good. And now I'm gonna listen to your heart. Listen to your heart. And again, I'm gonna put this inside. Okay, so I'm gonna check for the aortic valve, and then the pulmonic, and then the Erb's point, and then the tricuspid, and last one, the mitral. Okay, perfect. Your heart sounds good, normal. Now, we're gonna assess for the abdomen, but just let me ask you some things.
Okay.
Have you had any changes in your dietary habits?
No.
Any changes in bowel movement?
No.
Any changes in your urinary patterns?
No.
No? Okay. So now, can you lay down on the bed?
Okay.
I'm gonna, yes.
That way?
Yeah, that way, that would be okay. Okay. So I'm gonna start first listening to your bowel. Okay. Now I'm gonna palpate first lightly, and then I'm gonna be a little bit deeper. touch a little bit deeper just to look for masses, okay?
Okay.
And now I'm just gonna percuss it. Okay. Now can you stand up? I'm just gonna assess, can you turn? I'm just gonna assess for the angle. Okay, just give me a second. Okay, that's perfect.
Okay.
You can take a
Mhm.
sit. Now we're gonna continue with the questions. Have you had difficulty walking?
No.
No? Have you had any difficulty doing any daily activity?
No.
Any joint pain?
No.
No? Okay. Now, can you take a walk from here to there?
Okay.
Just wanna
Straight?
assess your gait. Yes. Okay. You can turn back and have a sit. Perfect. Okay. Now I'm gonna ask you, can you push? Now can you pull? Okay. Now I'm gonna do it with your legs, okay? You are gonna go out. Okay, now in. Okay, perfect. Okay, I was just assessing for your strength. Now I'm gonna assess for the range of motion. So I want you to go forward and back and out, and back and up. Okay, now the other arm, front and then out and in and okay, good. Now I'm gonna do with the wrist, okay? So go like this and then there and then try go sideways. Yeah. Okay, perfect. Now wanna do it with your hips, but that's gonna be at last. We're
Okay.
gonna lay down. So first, let's watch for your ankles, your feet.
Mhm.
Can you go like that? Okay, now down. Okay, now try. Okay, and now in. Okay, perfect. Now, can you lay down again on the bed? I'm sorry.
No, that's fine.
Now, try to go up with one of the legs up. Yeah, straight and up. No, just your leg. I'm
Oh.
sorry. Yeah.
All the leg. Oh.
Yeah, and then okay. Now go out and now go all the way in. Okay, perfect. Now the other leg. Go up. Yes, and then out and all the way in. Okay, perfect. Now can you sit on the bed? Last, okay? So for the tender reflexor, we will be tapping the patella this side, and the leg is supposed to rise. The same is for the other leg, and then for the Achilles is gonna be tapping behind, and the feet is supposed to rise a little bit like that. And last one for the Babinski, we're supposed to touch the feet, and yeah, there you go. The reflex will be like that. Okay, now you can take a seat. And last thing, I'm gonna be asking you about swelling. Have you had swelling in your upper body or your lower extremities?
No.
No? Okay, so I'm gonna be checking that. Can you show me your hands?
Mhm.
Okay, can you show me your ankles and your feet? Okay, so no edema. And now I'm gonna be checking palpating your radial pulses. +2, now your brachial. +2, and last one, your +2 as well. So let me just write this down. Okay, So everything looks all right. Everything is complete, I think, and I'm gonna be seeing you at the next appointment. Okay.
Okay.
Okay. Good day. Have a good day.
Thank you. Bye bye.